Every major health outcome begins somewhere, often with a physical change so small it's difficult to categorize. This raises a question: how do we decide which of these moments deserve our attention? At 69 years old, Susan faced this decision during a routine morning. While getting dressed, she noticed a minor physical variation that hadn't been there before. The change was entirely painless. Because it didn't interfere with her schedule or cause discomfort, it lacked the typical urgency we associate with a medical problem. Susan's experience highlights a common tension. When a symptom is subtle and silent, the natural human instinct is to prioritize the demands of the day and assume everything is fine. We are often conditioned to react to loud health alarms, sudden illness, or acute pain that forces us to stop what we're doing. However, conditions like breast cancer often operate on a different timeline, beginning with microscopic shifts that trigger no immediate alarms. Weeks passed for Susan while the change persisted. In these quiet windows of time, the risk is not just the condition itself, but the comfort found in waiting to see what happens. It took a friend's encouragement to shift Susan's perspective, eventually leading her to overcome her reluctance and schedule a professional evaluation. Seeking an external medical opinion is the first active step in replacing uncertainty with clinical facts. That evaluation moves the focus from personal observation to biological reality. Organizations like the World Health Organization and the NIH recognize breast cancer as one of the most common cancers globally. The process begins when abnormal cells in the breast start to grow and divide without the usual biological restraints. During these early stages of division, the cluster is too small to be felt as a distinct lump and far too localized to cause systemic pain. Identifying this growth while it is still localized significantly broadens the range of effective treatment options and improves long-term outcomes. Because cellular division is a progressive and hidden process, consistent awareness provides a necessary window for early medical intervention. As these internal cellular changes advance, they eventually manifest as physical variations that can be seen or felt on the surface of the body. One primary sign is a new lump or a distinct thickening in the breast tissue or the underarm area. Attention should also be paid to any unexpected asymmetrical changes in the breast's overall size or contour. The skin may also show localized changes, such as dimpling, puckering, redness, or persistent irritation. Specific nipple changes require evaluation as well, including inversion, discharge unrelated to breastfeeding, or persistent crusting. While general breast pain is common, a professional should investigate pain that is persistent and concentrated in one specific area. Recognizing these signs provides the specific information a healthcare professional needs to conduct a formal diagnostic evaluation. Physical symptoms have a limit. Sometimes abnormal growth presents no external signs at all. Routine mammograms and regular health checkups provide a specialized layer of defense, detecting changes that remain invisible to the naked eye. Susan's evaluation did reveal a condition that required treatment. Because she acted when she did, her medical team was able to address the issue in its early stages. Early detection relies on this dual approach, maintaining an awareness of physical changes while participating in scheduled clinical screenings. Vigilance is particularly important as risk factors evolve with age, family history, genetics, and lifestyle choices. Proactive health starts with a baseline of familiarity. By knowing what is normal for your own body, you become capable of spotting even small deviations. Specific habits support overall breast wellness after 50, including the maintenance of a healthy weight and regular physical activity. This checklist is completed by eating a balanced diet, limiting alcohol consumption, and not smoking. These daily practices transformed healthy aging from a passive hope into an active, managed process. Susan's perspective today is one of confidence rather than fear. She views her body's signals as information that creates opportunities for better outcomes. The objective is not to worry about every minor sensation, but to distinguish the specific changes that warrant a conversation with a doctor. Healthy aging is about trusting yourself, and that every screening is an investment in future independence. Next time, we will be looking at reversing biological aging and separating scientific reality from popular myths. Our influence over our own longevity often comes down to the daily choice to observe, recognize, and act on what we find.
Remember, life after 50 isn't about slowing down. It's about living stronger, healthier, and happier. If you enjoyed this video, please like and subscribe, and share it with someone you care about. This is Longevity After 50, adding life to years, one step at a time.